whenever you have a child who has difficulty with communication, a lot of times mom and dad or caregivers are making those decisions and therapist is giving input into that, right? So that's kind of how we've been doing it. We have to be looking more at what is the child interested in? What are those preferences? We have to look towards, those advocacy. That child may be advocating for themselves in a nonverbal way. And so being able to read that and move forward with that, but also taking the expertise of the therapist and the knowledge of the parents and putting it all together.
Assessing preference. There are ways that we can do this in ABA that we, do a preference assessment, look at what the person is interested in and try to use those things as much as possible in therapy. Aside from that, teaching the individual to communicate their wants and needs, how to, even things as simple as like making choices and including that in treatment so that they can down the road become better self-advocates and express the things that they want and need more clearly with the people who maybe aren't able to as quickly understand what they're trying to say as maybe mom and dad might say. Because we all know that, mom and dad are great advocates, but our preferences change. If we were to ask my mom what my favorite meal is or my favorite snack, she might say something that's completely off base because it was 20 years ago. But preferences change, and continuing to assess those over time and to incorporate those, not just, once a month, but every single day. What are you interested in today? What sounds good today? And again, incorporating as many opportunities to make choice and to speak for yourself as possible.